it's Jessica DaMassa with WTF Health. I'm here right now at HIMSS 19 with my good friend, Konya. He's the Senior Innovation Strategist for the Office of the National Coordinator for Health IT, lovingly known as the ONC. Hi.
Hi, how are you?
Great. So I want to jump right in and talk about Together.Health, the rebranding, newly relaunched digital health collaborative. So talk about the initiative as it started out. Why rebrand now to Together.Health?
Yeah. So the reason why I got involved and was looking to partner with Nick and others on bringing Together.Health, which was originally known as the Digital Health Collaborative. Selfishly, my job at ONC is to build a structured relationship with the innovation community. Mm-hmm. So how do we push out new rules and regulations, the toolkits, the resources we have, all that information that can benefit startups, investors, incubators, accelerators, boot camps, and so on. And then also, how can we collect feedback from those communities about what are the barriers to innovation in the marketplace? And then we could think about what rules or regulations do we need to put in place? Are we serving as a barrier to innovation? Yeah. So what do we need to do to help remove those barriers and that friction in the marketplace? But the problem is that there's turnover, there's challenges. It's one thing just to know them, but if I were to leave the job tomorrow, how's ONC going to maintain that relationship? And so getting them to work together, now there's a structured program. Yeah. Where we can then plug in and out of and have a mechanism to push it out, kind of like a hub and spoke model, so we can easily communicate messages and collect feedback from them.
Okay, and I love the shift now to Together.Health because I think it's you guys realize that this is just more about more than just digital health, and the people that you've brought in are pretty impressive. So talk through some of the other organizations beyond just the accelerators and the ecosystems that are almost based in the cities and the states. You've got them, but who else is involved right now?
So really, you'd be amazed. We've been amazed at the level of excitement, and we've made it a safe place where everybody can work together. It's non-competitive. Mm-hmm. They all understand that it's going to take working together. There's enough pieces of the pie to go around when it comes to solving problems in healthcare. Yeah. So they don't have to fight and squabble over it. They can leverage each other's assets. But so we do have over 27 cities with regional ambassadors represented. And that's going to be the incubators you're talking about, Matter out of Chicago and HealthX out of Chicago, Mass Challenge Health Tech out of Boston, and so on. Team CX in Houston. Exactly, and Prime Health in Denver. Yeah. You name it, name a city, we know who is that ecosystem champion there. But getting to your point about who else, you've got Health 2.0, HIMSS, J Labs, Johnson & Johnson Labs, Accenture and their life sciences health accelerator programs. We've got Node Health, a network of digital evidence health. We've got also Startup Health. They're all part of this, and it's a safe place where they can all work together.
Which is really cool because it's almost this is something that we've been missing for a while, is one convening thing that could bring all of the innovators together. So it's really neat. And you guys had a rebranding event here at HIMSS. This was your second event, right?
So technically, this is going to be the third event as we launched it as an actual collaborative. Okay. It was HIMSS this past HIMSS where we launched it as the Digital Health Collaborative as a placeholder name, and then eventually we came up over the next year with Together.Health. But there was even one event that was a precursor to that in October 2017 where we started bringing together all these different champions and trying to just validate the idea that they would be willing to work with each other. Right. And what came out of that first event was a resounding yes, that they did want to, and we had a lot of ideas about what they'd be willing to work together on, and ultimately that's led to some of the projects that we're working on now. Okay,
so talk about the projects, because I know you guys detailed 3 of them that you were working on when you spoke here at HIMSS this time around at the Together.Health event. So what are the 3 projects you guys are working on?
So if you go to our website, Together.Health, you can scroll on the first page and you'll see the 3 projects there. Yep. We're also building out a tab to go into more detail on each of the projects. Right now, the only one that has a lot of detail on the website is the Common App for BAA and Security Risk Assessment. Okay. So I'll do my best to explain it since Nick is leading that project. I'm not.
Nick, we keep referring to as Nick Doherty from Mass Challenge Health Tech. Right. And he's partnered with you on developing this.
Yeah. So Nick and I served as the founding co-chairs for Together.Health. Right. So with this project, the BAA project, they essentially are looking at the Business Associates Agreement process and how long it takes for startups to go through that when they're lined up to work with a hospital or a private sector company, and it stifles a lot of innovation. So, they could be agreed on the terms of the contract, what the scope of work is, even pricing, but then it goes to the legal teams and they go through this process and it can take 9 months sometimes, 12 months before any work is happening. And so it does a couple things. One is startups can't survive that revenue cycle. and they drain their resources and they die before the project ever gets off the ground. And for the hospital that's trying to work with this, the team that was excited about it now has a bad taste in their mouth about it takes too long to get these things to work. Right. It was a waste of my time. I don't want to do it again, right? So we're trying to figure out how can we standardize that BAA process across all the partners to expedite. If they can get 80% of it standardized, then as a goal, for instance, get them asking the same questions in the same format. How can they then get that down to being a 3-month or 1 month or even faster process to get some of these ideas actually validated into the market faster?
Right. And then the other two real quick were?
So the other two is an ecosystems mapping project. So you got to, just to kind of know what assets are available in all the different regions to support innovation. Yeah. What are the different hospitals that have innovation programs? What are the incubators, the boot camps, private sector partners that are also engaged in supporting in that regional ecosystem. So actually cataloging all of that, then physically mapping it, and then using some analysis to tell a story of all the regions. So what makes Austin unique when it comes to healthcare innovation compared to Denver, compared to Madison, Wisconsin, compared to Silicon Valley? What are their strengths? Do they have a special sauce about their region where they specialize in a certain area of healthcare and digital health because of other assets? So like Austin, you see a lot of VR and gamification type AR companies coming out because they have a big gaming community there.
Same with LA because of the movie industry.
Yeah, exactly, right? So obviously you see a lot of third-party apps that improve and provide solutions on top of EHRs coming out of Madison. Right. Go figure, right? so just being able to tell that on a consistent stories and have numbers to back that up eventually. Yeah. And then the third project is right now it's a common curriculum project. So a lot of these regional programs that are trying to help startups understand the landscape of healthcare. Some of it's just startup 101, protecting your IP and so on. Right. Sometimes the curriculum they have is, understanding HIPAA or some of these other federal policies. And so what they're doing is now they're pooling their resources across all these incubators and elevators. Smart. So you had TMCX who said, they raised their hand and said, we've got one person to manage all of our curriculum development and keep it up to date. So we would love to partner with Matter in Chicago, with Nick's program in Boston, and say, what curriculum do you have? If you have something that I don't, will you stream that to my members and vice versa? And if there's something that none of us have, let's work together and pool our resources on developing that new curriculum.
So everybody should be watching WTF Health videos to learn about the industry and meet all of the key players. All right, last question for you. I want to real quick. We just had at the beginning of the week here at HIMSS, the ONC, HHS announced all the new rules. So the ONC rules for electronic health information, and then there were CMS rules that went along with it. But
under 21st century cures.
Yes, and so I'm wondering if you can weigh in for us on the ONC side of this about the new rules.
Yeah, so we're really excited that the rules is finally now coming out for public comment.
I've been asking lots of people about the rules, and people are really excited about the rules.
It's a big buzz. I heard somebody just walking in the background talking about have you read all the pages yet? Everybody's digging into it. Yeah. So
their branded highlighters in their booth right
now.
And
we've been waiting for this to come out, but that's given us some time to really be prepped about it. And our comms team at ONC has been fantastic. They put together, there's at least 9 fact sheets that break down the different components that in very simple terms. Cool. There's a fact sheet, for instance, on APIs and the fees and what we're proposing as far as the limitations on what you can and can't charge fees for associated with API access, EHI, electronic health record or health information exporting, and mandating the ability for patients to get it exported in a standardized fashion, and then also some language around making ONC be able to issue waivers around standards and remove a ceiling for what's required. So that way we could say, here's the floor and feel free to innovate and go as high as you want. And we can basically approve you to go do that. So we can continue to support innovation and not put a ceiling on it.
Awesome. Well, that's so cool. Stefan, thanks so much for talking to us and walking us through all the amazing resources that are available, not only through ONC, but also through Together.Health.
Yeah.
Pleasure to talk to you.
No worries. I will give one last plug, healthit.gov. Go to the website, subscribe to our newsletter. You'll continue to get updates. Comment on the public rule. Once it's out and available for public comment, there'll be a 60-day period. And really, we need the innovation community to provide feedback.
Awesome. Thanks so much, Stefan. I'm Jessica DaMassa with WTF Health here at HIMSS 19. Thanks so much for joining us.